Okay, welcome everybody. Our annual Nevada Silk meeting. We have a full and exciting agenda. So I'm going to ask Storm to call roll.
Yeah, Julie, you just asked me to do roll call, is that correct?
Yes, please.
Sorry, this is Dawn Lyons. Roll call. Julie Weissman Steinbach,
Present.
Sabra McWhorter Clark,
I know she's there.
she was here. Oh, there she is. I see her. Let me see. She might be having trouble unmuting, so I'll give her a minute to sort through that and come back. Margaret Marcucci just messaged me saying she is trying to get into the room, but she's having internet issues, so she may join us soon. Linda Veboda, I do not see her yet. I know she did say she was coming though, so she may just be running late. Peter Whittingham. You know, if I recall, Julie, I think Peter emailed us a couple months ago saying that he wouldn't be able to make this meeting, but I could be wrong. But I'll double check on it and we'll note that whenever I find it.
Yeah, I don't remember that.
Okay, DD Master. See her either. Lisa Bonney.
Here.
Thank you. Obioma Officer.
Present. Hello.
And Sheena Childers is excused absent today. Lori Lutu.
Here.
And Margaret Marcucci, you just joined us, correct?
I did. Everything's going up and down. We have over 30-mile-an-hour wind gusts, so you never know what might happen.
Okay, and I'm gonna let Sabra try to unmute one more time. Sabra, can you unmute yourself, or do you want to just put a message in the chat?
Yes, hi, I'm here. This is Sabra McWhorter Clark. Thank you. Technical issue.
Thank you. And we do have quorum.
The next is public comment. Dawn, can you read?
I sure will. Okay. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
Okay. Molly.
Hi, folks. This is
Molly Rose Lewis, last name Lewis, Lewis. I'm with Senator Jackie Rosen's office. I work in our Reno office covering the disability community for Northern Nevada. We have my counterpart in the Las Vegas office as well. I just wanted to let you know that I am here and will be listening to as much as I possibly can. Really appreciate all of the notices that you send out. And please keep us posted if we can help you. If you're seeing federal funding cuts, which we know probably won't take effect for a while, but if you see anything in the interim that is happening and affecting your abilities to do your work, please let us know. I'm also the grants federal funding point person for the whole state for our office. And then as just a quick reminder that we're able to help with federal agency assistance for individuals and organizations. If anything comes up that we can help with, like Social Security and Medicare, or other things, immigration, passports, things like that, please do let us know. We are here to help you. And thanks so much for letting me be here.
Welcome. Are there any other? Oh, okay. Okay.
Yes, hello everyone. This is Obiama officer speaking from the Nevada Deaf and Hard of Hearing Commission. I would just like to take a moment and say that this meeting today and tomorrow is going to be my final meeting. I have gained a plethora of experience through my 3-year term with all of you. And I just want to say thank you, everyone, for including me in the team, the commission, and all the action that you have been taking. This council has been a beautiful addition to my knowledge base and my growth as a member of the disability community and a person with hearing loss. So thank you. And I am here. Reach out to me for anything that I could be assistance with. I'm looking forward to partnering and collaborating with everyone in the future. Thank you.
Thank you so much, Obiama. We will miss you. Any other public comments?
Yes, thank you.
Do you see any other hands?
I do not see any other hands up at this time.
Okay, if that's the case, we're going to move on to the approval of the minutes from April 9th and 10th. Does anyone want to make a motion to approve the minutes?
Julie, this is Margaret Marcucci for the record. I make a motion that we approve the minutes.
Do I hear a second?
This is Sabra McWhorter Clark. I second.
Okay, all in favor? Aye.
Aye.
Any nays? Motion passes. Okay, next, we're going to move down to item, I think it's 7. Yeah, no, item 6. And I'm really excited to invite Teresa Campbell from Social Security to speak to us. Welcome, Teresa. and we're very excited you're here.
Okay, thank you. Thank you, Julie and Dawn, for inviting me here. If there's at any point where you can no longer see my screen, if I need to reshare my screen, please let me know. Or if I need to slow down, please let me know. So I've worked for Social Security for over 34 years. And the reason that we really like providing this information is because the decisions that you make about your retirement, so when you're going to retire, for instance, and when you're going to start your Social Security benefits, those are going to be some of the most important decisions that you make in your life. And there's no right or wrong decision. We're all going to make different decisions because we all have different life circumstances. We just want to make sure that you have all the information you need so that when the time comes, you'll be able to make an informed decision. So we're going to talk about Social Security disability and SSI. We're going to talk about Social Security retirement, how benefits are calculated. We're going to talk about benefits for your spouse and even your ex, because your ex may qualify for benefits on your record. And we're going to talk about Medicare, the various parts of Medicare, and when you should apply for your Medicare. Okay, Social Security is a wonderful program that has made an enormous difference in the lives of millions of Americans. It has allowed families to stay together after times of crisis. So I know that when we think about Social Security, we usually think about retirement benefits. But we're not just a retirement program. We also have benefits for individuals who can no longer work because they have a disabling condition, and for dependents when a mom or a dad passes away. And it has raised the standard of living for lower income Americans. And the way that Social Security does that is by providing a slightly more generous benefit for individuals who have had lower wages in their lifetime. That allows everyone to retire with financial independence and dignity. Okay, so a young person actually has a 1 out of 4 chance that they will become disabled before reaching retirement age. A young person has a 1 out of 7 chance that they will pass away before reaching retirement age. So that means a young person has a 1 out of 3 chance that they will become disabled or pass away before reaching retirement age. And so Social Security is there for you and your family when those unexpected events occur. So that's what we call Philosophy 101. Sometimes life doesn't turn out as planned. Okay, so the way that Social Security works, when you work and you pay your Social Security tax, right, 6.2% of your wages goes to Social Security, and your employer matches that 6.2%. We keep track of how much you earn, and we keep track of your taxes because we use that information to calculate your benefit. However, what you pay in taxes goes to current beneficiaries. And if anything is left over, it goes into our Social Security trust funds. So some people think, it's going into an account with my name on it, just like a savings account or a CD. But that's not how it works. It goes to current beneficiaries. Okay, so disability, it's something that can really happen to us, any one of us at any time in our lives. And Social Security offers that protection when the unexpected happens. So Social Security administers 2 disability programs, and it's easy to get the 2 confused because they sound like they're almost the same thing, but they do have some differences. One is called Social Security Disability Insurance, or SSDI, and these are payments that come from the Social Security trust funds, and they are based on a person's earnings. So it's an earned benefit, and you earn that benefit by working in jobs where Social Security tax was being withheld from your pay. So in order to get SSDI, you need to have the qualifying disabling condition, and to have worked and paid those taxes. So it doesn't matter what your other income and resources are. So if you're a veteran and you're receiving a veteran's disability payment of $2,000 or $3,000 a month, you would still be able to qualify for the SSDI payments because we don't take your other income and resources into consideration. Also, because Social Security, like we said, it's a family protection program. So if a worker qualifies for SSDI benefits, that means that their dependents can also qualify for benefits. So if they have a child who is dependent because they are under age 18, or if they have an adult child who became disabled prior to age 22, they could qualify on that record. And sometimes the spouse can qualify too. The other disability program that we administer is called Supplemental Security Income, or SSI. Those payments come from the general Treasury Fund, not from the Social Security Trust funds. So they are not based on a person's earnings. SSI is a needs-based public assistance program. So that means that, for instance, even a newborn baby could qualify for SSI benefits. So that child has never worked. But if the child has a disabling condition and the parents have limited income and resources, the child could qualify for SSI benefits. Also, individuals who are age 65 and older who have limited income and resources could also qualify for the SSI benefits. Now, the disability decision for both programs, for SSDI and SSI, it's the same. So if you're medically approved for one, you're medically approved for the other, but the difference has to do with SSDI based on the fact that you've worked and made and paid Social Security tax, or you're the dependent of someone who did. SSI based on the fact that you have limited income and resources. Okay, so the definition of disability for an adult, it's a little bit different for a child. The child definition of disability is not as stringent as it is for an adult. But for an adult, it means the inability to engage in substantial gainful activity due to a medically determinable impairment, which can be expected to result in death, or which has lasted or can be expected to last for not less than 12 months. So it would not be for a temporary disability condition. It would be for something that's expected to last for at least 12 months. Medicare goes with Social Security disability. So if you receive Social Security disability for 24 months, you would then qualify for Medicare. And this next one, it should actually say Medicaid, not Medi-Cal. I'm in California, so I'm always thinking Medi-Cal, but Medicaid in Nevada, that goes with SSI. So for every month that you qualify for SSI, you also qualify for Medi-Cal. Okay, so retirement. So I know this is what we think about when we think about Social Security. We think about retirement, and if for good reason, about 70% of our beneficiaries receive because they are retired or they are dependent on someone who is retired. Okay, so nobody can receive a Social Security retirement payment unless you have worked in jobs where Social Security tax was being withheld from your pay. So when you work and these taxes are being withheld from your pay, you are earning what's called credits. So the amount of money that you need to earn in order to earn one credit changes a little bit every year. So this year, each $1,810 in earnings provides you with one credit. You can only earn 4 credits a year. So that means this year, if you had earnings of 7,240, that means you have maxed out your credits for the year. You can't earn any more. We still count your wages because we use that information to calculate your payment, but you've maxed out your credits. You need to have earned 40 credits in your lifetime in order to qualify for a payment. And they don't need to be consecutive. So once you have earned a credit, you will always have that credit. It will never go away. So that means with as few as 10 years of work, you would qualify for a Social Security retirement payment. Okay, so this is how Social Security calculates a retirement payment. First, we look at your wages throughout your entire lifetime. And so some people think we go by your last 10 years or your last 3 years or your last 5 years, but we use your highest 35 years of earnings. We adjust those earnings for changes in wage levels over time, or we adjust that for wage inflation. We add all those wages together and we divide it by 420. There's 420 months in 35 years. And the result is your averaged index monthly earnings. So we say this is the average amount that you earned in your lifetime. Now, we always use 35 years when we calculate a retirement payment. But remember, we said you only need 10 years to qualify for a payment. So what happens to the worker who has 10 years where they paid in? That means for 25 years, we're using 0 in the calculation. That worker's average index monthly earnings would be much lower than the worker who has 35 years of work. Okay, then there's a 3-tiered computation that we apply to your average index monthly earnings. We take 90% of the first 1,226, 32% of the next 6,165. If there's anything left over, 15% of the remainder. We add it together, and that is your payment at your full retirement age. So there's a couple things that you'll notice about our payment. The first one is that the higher your average index monthly earnings, so the more years you worked and the higher those earnings were, the higher your payment is going to be. The other thing that you'll notice is that Social Security pays a WAID benefit. So that means if there's a worker and their average monthly earnings was $1,226, they're going to receive 90% of that back in a Social Security payment, and they get that payment for the rest of their lifetime. The average paid worker has maxed out the first tier, has a lot of earnings in that second tier, and they receive about 40% of their average monthly earnings in a Social Security payment. So that is what Social Security intends to do. For the average paid worker, we intend to replace about 40% of your average monthly earnings. A high paid worker has maxed out the first tier, maxed out the second tier, has a lot of earnings in that third tier, and they might receive only about 26 to 32% of their average monthly earnings. So here we have a worker whose average monthly earnings was $8,000. So we take 90% of the first 1,226 and we get 1,103. 32% of the next 6,165 and we get 1,972. There's only $609 left over for the third tier, so 15% of that is $91. So this person's Social Security retirement at their full retirement age would be $3,166. Now, a quick note about disability. If you can no longer work because you have a disabling condition, we use fewer years in the calculation. So we're not going to use that full 35 years. We use from age 22 into the year before you became disabled. And then we can, depending on how old you are, we can even exclude additional years from that. So for a disability payment, it's not going to be disadvantageous to you because you didn't have the opportunity to work as many years.
Do you want me to plug my headset in? So we'll say.
Okay, the other thing that you would want to consider is your age when you start to receive your Social Security. So the increase in the full retirement age, that was part of the 87 amendments to Social Security, but it was phased in very slowly. So now if you're born between 1943 and 1954, your full retirement age is 66. You can still start to collect as young as age 62, but your benefits would be reduced 25%, and that reduction is permanent. If you're born 1960 or later, your full retirement age is 67. You can collect as young as age 62, but your benefits would be reduced 30%, and that reduction is permanent. Or you could wait. You could start after your full retirement age. Your benefit amount will increase 0.2% for every month that you wait past your full retirement age, or 8% per year up until age 70. So once you have reached age 70, you can no longer earn those delayed retirement credits. So don't wait past age 70 to start your Social Security, because then you're just missing out on these payments that you qualify for. Okay, so a lot of times, just kind of to make it understandable, we say, you know, you can start at 62, you can start at your full retirement age, or you can wait until age 70 so that you've maxed out your delayed retirement credits. But it's really a continuum. So you can start anytime between age 62 and 70, and the later you wait, the higher your payment amount is going to be. So you might want to start at, 64 and 8 months. You might want to start at 65 when your Medicare is going to kick in. If you start prior to your full retirement age, the decrease is about 0.5% for every month that you start prior to your full retirement age. If you start after your full retirement age, the increase is 0.2% for every month that you wait past your full retirement age up until age 70. Okay, and cost of living. So your Social Security is going to be protected against inflation. So whatever the Consumer Price Index tells us was the rate of inflation from the third quarter through the third quarter of the year before, that's how much the Social Security is going to increase. So this past year, the cost of living was 2.5%. Now, some years, it doesn't happen very often. I think it's happened twice since I've worked here. There's been deflation. In that case, the payment amount stays the same. So it either increases or it stays, and usually the vast majority of the time it increases because there's been inflation, or it stays the same. Okay, and you would also want to think about whether you're going to continue to work. Now, once you have reached your full retirement age, you can continue to work. It doesn't matter how much you make. You would still be able to receive your Social Security retirement payment. But if you are younger than your full retirement age, there is an earnings limit. And the earnings limit, again, it changes a little bit every year. This year, it's $23,400. So if you were working and you earn less than $23,400, you could still qualify for those retirement payments, even though you're younger than full retirement age. If you make more than that, for every $2 over, one is withheld from your payment. The year that you turn full retirement age, for the months before the month you turn full retirement age, the earnings limit is $62,160. So if your full retirement age is in April, if between January and March you make less than $62,160, you could receive those 3 payments. Your permanent check will be reduced a little bit because you received 3 payments prior to your full retirement age, but that's an option you have. And if you make over that limit, for every $3 over, one is withheld from your payment. Now, let's say that you started your payments prior to your full retirement age. You provided an estimate of your wages and you made more than you expected. That means you would get a notice from Social Security saying, we've paid you too much. We should have withheld some of your payments or more of your payments to eat up those excess earnings. But then when you turn full retirement age, you get credit for those months you were not due a payment, and your permanent check would increase. Okay, I'm actually going to skip this slide because the taxation of Social Security benefits, we've been notified that there's new information on this, but we haven't been given the specifics. So I don't want to say anything that's incorrect with the new legislation. However, it's possible that your Social Security could be subject to federal taxation. The state of Nevada does not tax your Social Security, but the feds may. and we can withhold federal tax from your payment if you want us to. You would just tell us the percentage to withhold, and then you can always ask us to withhold more or less. Okay, and spouse's benefits. So a spouse who didn't work or a spouse who didn't earn very much can qualify for 50% of the worker's unreduced benefit at his or her full retirement age. If they collect prior to their full retirement age, there is a decrease for early retirement. You and your spouse must have been married for at least 1 year before they could qualify for benefits. Anything paid to your spouse does not take away from you, so it's in addition to what you receive. So for an example, let's say just hypothetically that my Social Security payment is going to be $2,000 a month, and my spouse receives a payment of $700 a month. That means he could receive an extra $300 on my record. Okay, so going back to our example, let's say that I'm receiving $2,000 a month, and my spouse isn't insured, so he didn't earn his 40 credits. That means that he could receive $1,000 on my record. And again, anything paid to my spouse does not take away from my payment. You can even receive benefits on your ex-spouse's record, even if he or she has remarried. As long as you are unmarried, you need to be currently unmarried, age 62 or older, and the benefits that you are entitled to receive on your own work is less than the benefit you would receive on your ex-spouse's work. So if your ex's benefit is more than double your benefit, you can receive that additional payment. In order to qualify for benefits as a divorced spouse, you must have been married for at least 10 years or longer. So the duration requirement for a current spouse is 1 year, but the marriage duration requirement for an ex is 10 years. Okay, so the loss of a loved one, it's both emotionally and financially difficult. So Social Security has that safety net when the unexpected happens. So when we pass away, our children would qualify for survivor benefits as long as they are under age 18 or under age 19 and still in high school, still full-time high school student, and they're unmarried. If you have a child who became disabled prior to age 22 and is unmarried, they could qualify for disabled adult child benefits. So when you pass away, maybe your child is going to be 40, maybe your child's 40 years old. But if he or she became disabled prior to age 22, they could qualify for the disabled adult child benefits. And then your widow or widower could receive benefits as young as age 60 or 50 if they are disabled. A young husband or young wife would also qualify for benefits if they are taking care of your child who is younger than age 16 or your child who is older than 16 and has a disabling condition. So we do see this quite frequently where the young husband or young wife passes away and the surviving spouse and the children would all qualify for the survivor benefits. Okay, so your surviving spouse would receive 100% of your benefit amount if they were to wait until their full retirement age. If they were to collect at age 60, they would receive 71.5% of the benefit amount. So the surviving spouse can start anytime between age 60 and full retirement age. The later they wait, the higher the payment amount is going to be. Now, you and your spouse must have been married for at least 9 months in order for them to qualify for survivor benefits. So that's the marriage duration requirement for the survivor payments. Okay, also, survivors have different, we call them claiming strategies. So let's say that you're receiving a survivor payment at age 60. At 62, you could check to see if your own retirement payment is higher. If you're already getting the higher payment, you would do nothing. But if you could get a higher retirement on your own record, you can switch over now at 62. Or you could wait until your full retirement age and get 100% of your payment, or you could wait until you're 70 and you've maxed out your delayed retirement credits. Or you could do the reverse of that. So you could collect your own retirement payment at age 62. And then at your full retirement age, you could switch over to the survivor payment and get 100% of that payment. So usually it's better if you can afford it to take the smaller payment first. So take the payment on the lower earnings record first, and then switch over to the higher payment later in life when you may need more income. So if you are a surviving spouse, we would like to talk to you a couple of months before you turn age 60 so that we can go over the numbers with you and you can make an informed decision about which benefit you want to take and when. Okay, a divorced widow or widower could also qualify for the survivor benefits as long as that marriage lasted at least 10 years prior to the divorce and they are currently unmarried. However, if you remarry after age 60, it does not affect entitlement to widow or widower's benefits. Okay, and Medicare. So Medicare is actually run by another federal agency. It's run by CMS, or the Centers for Medicare and Medicaid Services. However, you apply for Medicare at Social Security, and we have a lot of information about Medicare. Okay, so Medicare eligibility starts at age 65. So even though our full retirement age has gone up, Medicare age is still age 65. Or if you receive Social Security disability, you qualify for Medicare after receiving after being entitled for 24 months. Individuals with ALS receive Medicare without that waiting period. And individuals with end-stage renal disease who are using dialysis or are waiting for a kidney transplant could qualify for Medicare to pay for the dialysis and the kidney transplant. And you could, in that case, you could even qualify for Medicare if you're not receiving benefits. You can also, if you're not insured, you can use your spouse's credits for Medicare for the dialysis or for the kidney transplant. A child can use their parents' credits in order to get Medicare if that child has end-stage renal disease. Okay, so Medicare has these different parts. Part A is the hospital insurance and Part B is for doctor visits. And you apply for Medicare Part A and Part B at Social Security. Now, if you have Medicare Part A and Part B only, then you have what's called Original Medicare, and it will pay 80% of your approved medical costs. Now, if you have Original Medicare, so Part A and Part B only, you can also purchase a Part D plan, prescription drug plan, and you do that directly with the insurance company. Now, if you're going to have Original Medicare, so Part A and Part B only, remember, it only covers 80% of your approved medical costs. So we would recommend that you purchase a Medigap policy and you do that directly with the insurance company to cover that 20% that Original Medicare doesn't cover. The other option is you again apply for Medicare Part A and Part B at Social Security, and then you sign up for a Medicare Advantage plan or a Medicare Part C plan. And those are the HMOs and some PPOs that are offered by private insurance companies. All of the Medicare Advantage plans have been approved by CMS, and by law, they have to cover everything that's covered under A and B, and they usually have other things rolled into their plan, such as the prescription drug plan. They offer extra benefits like dental and vision. And the Medicare Advantage plans are really cost savings plans. So pretty much whatever you're paying for your Part B premium, that's going to cover everything for the Medicare Advantage plan. So why would somebody stay with Original Medicare and purchase a Medigap policy? Well, the reason is because of the flexibility. That means that you can go to any hospital or see any doctor who will accept you as a patient. So if you want to see that specialist on the East Coast, you can do that with Original Medicare and the Medigap plan. But the disadvantage of that is that those Medigap policies can be pretty expensive. So with the Medicare Advantage plan, those are the cost savings plans. But what some people could see as a disadvantage of that is that you would then need to stay within that network. So if you wanted to see that specialist, you would need to obtain special permission from the Medicare Advantage plan to do that. Okay, so there's the enrollment periods for Medicare. The initial enrollment, it begins 3 months before you turn age 65 and it ends 3 months after you turn age 65. So if you're collecting a Social Security payment, if you're getting a retirement payment, a survivor payment, an auxiliary spouse payment, then we assume that you want your Medicare to start as soon as possible. So we sign you up for it automatically. You get your Medicare Part A and Part B card in the mail 3 months before you turn age 65. And then you just have to decide, do I want to stay with original Medicare and purchase a Medigap policy, or do I want to sign up for a Medicare Advantage plan? Now, if you do not have health insurance through your or your spouse's active current employment, then we strongly recommend that you sign up for Medicare's Part A and Part B during your initial enrollment period. So if you're not getting Social Security benefits yet, you would contact Social Security. You can go to ssa.gov or you can call us for an appointment to apply for your Medicare's Part A and Part B. Now, if you have health insurance through your or your spouse's active current employment, so you or your spouse are going to work every day, then you do not need to take Medicare at age 65. You can choose to sign up for your Medicare Part A, and that would be your secondary insurance. You have 8 months after you or your spouse stops working and you no longer have health insurance through that employment to sign up for your Medicare Part B. You will not be penalized because you are in your special enrollment period. Now, if you missed your initial enrollment period and you don't qualify for a special enrollment period, you can only sign up for your Medicare Part B during the general enrollment period. That's January through March of every year. The Part B kicks in the month after you sign up, but there could be a penalty. So for every 12 months that you could have had Part B and you didn't have it, the premium increases 10%, and that penalty is permanent. So no penalty under initial enrollment, no penalty under special enrollment, but there could be a penalty under general enrollment. Okay, now when it comes to navigating Medicare, so remember you contact Social Security to apply for your Medicare's Part A and Part B. We have a lot of information about Medicare. We're checking to see if you have enough credits to get your Part A premium free. If you don't, then we're looking to see if there's a spouse or a former spouse who has the credits that you can use to get Part A premium free. We make determinations about the Part B premium if there's going to be an additional surcharge for that if you're a higher income. But if you were to say, you know, what do you think I should do? Do you think I should just take A and B, and which Medigap plans do you know about, or which Medicare Advantage plan do you think I should sign up for? We wouldn't be able to advise you on that because we haven't been trained in it. But there is an agency that can do that. It's called SHIP, State Health Insurance Assistance Program. So SHIP is funded by the state of Nevada, so they provide that unbiased counseling. So if you contact SHIP, one of their counselors will meet with you. They can do a formulary plan with you, and they can advise you which way to go. And then if you ever run into difficulty with Medicare, or if you run into difficulty with a provider, they have ombudsmen there as well to help you sort through those issues. So hopefully there never will be any problems. And in the great majority of cases, there are. But I can imagine that with a big bureaucracy like Medicare, if something's not going smoothly, how that could be upsetting. So they have those advocates and those ombudsmen who really know how the system works and who to talk to straighten out issues. Okay, and this is our website, ssa.gov or socialsecurity.gov. We have all kinds of financial plans and calculators to help you prepare for your secure financial future. My Social Security, this is a secure and convenient suite of services. It's designed to put you in control of your own personal Social Security information. So the information that we know about you, we don't know any kind of secret information about you. Everything is here where if you were to create an account, you have access to that information as well. And when you collect your Social Security, you can manage your account online. So everything from the comfort of your home. If you receive benefits or Medicare, you can request your replacement Social Security card online as long as you're at least age 18, a U.S. citizen, and you have a driver's license or state ID. You can get your benefit verification letter as proof that you're getting benefits. Oftentimes that then qualifies you for other services. You can check your benefit, payment information, your earnings record, change your address, phone number, direct deposit information, request a replacement Medicare card, or get a replacement 1099 if you need it for taxes. If you don't receive benefits, you can request a replacement Social Security card if you meet those same criteria. You can check the status of your application. You can get a benefit verification letter, and then your Social Security statement to review. So if you're my age, you might remember receiving this in the mail. So 3 months before your birthday, every year you used to receive this statement in the mail. And you probably haven't received it for a long time. And that's because this information is online. So you can get that same statement information online. So you go to ssa.gov/myaccount, you sign in or you create your account. If you already have an account, then you put in your existing My Social Security name, username, and password, or your login.gov or id.me credentials. If you're creating a new account, you'll be directed to login.gov to authenticate you. And then you'll be directed back to the Social Security website where you will be asked to provide some personal information to verify your identity. So we ask you we call it out of the wallet questions. So we ask you some questions we think only you would know. We don't just ask you, where were you born? What's your mother's maiden name? We ask you additional questions like, 10 years ago, what was your phone number? And then there's, 4 phone numbers listed. Or which bank did you last apply for a credit card with? And then it lists several banks. If you answer a question incorrectly, it will kick you out. And this happened to me. I answered a question incorrectly and it kicked me out. But then it will let you back in 24 hours later to create your account. So it gives you another chance to answer the questions. Once you have created your account, then it's going to be secure. So nobody else is going to be able to pretend to be you and create a My Social Security account because you've already done it and it belongs to you. And then we will send you an activation code. So that's an extra layer of security. Okay, so when you're ready to apply for your benefits, 3 months before you want your benefits to begin, you can apply for those benefits online at ssa.gov. Now, if you are a surviving spouse, you would not be able to apply for those benefits online. And that's because you have those different options that we want to talk to you about. So in that case, you would want to call us 1-800-772-1213 or 1-800-SSA-1213 to apply for benefits. You can apply for benefits by phone or at the office. So if you're old-fashioned like I am, and I like to meet with somebody, I prefer not to apply for things online, even though applying for retirement benefits online would not be difficult for me. I still kind of like to talk to somebody. You can always call us and make either a phone or an in-office appointment. The application is very easy. It probably will take you 10 minutes or less. We ask you if you had a chance to create a My Social Security account and if the earnings information appeared to be correct. If you're younger than your full retirement age, we ask you to provide an estimate of your earnings. We ask you about marriages, so marriage beginning and ending dates, because we're checking to see if you could qualify for benefits on someone else's record or if they could qualify for benefits on your record. If when you tell us about a spouse, we look to see if you could qualify for auxiliary benefits or if you could qualify for survivor benefits. We might even contact your ex or your current spouse. Or your adult child who has a disabling condition and ask them if they would like to apply for benefits. Now, the disability application it takes longer than this. That's because we're collecting more information. So while a retirement application, an auxiliary spouse application, or a survivor application, it usually takes us 1 to 2 days to clear those cases and start the payments. The disability could take between 2 and 6 months for the initial decision. And if it's working its way through the appeal process, it can take even longer than that. But the retirement, survivor, and auxiliary applications, those are processed very quickly. Okay, well, thank you everyone for your attention. And are there any questions?
This is Dawn Lyons. Teresa, I had sent you a couple of questions that were submitted in advance. Do you remember getting those, or do you need me to read those to you?
So the first one has to do with the CalAble, right? If there's any changes in that. Or not, I'm sorry, not CalAble, just ABLE. So the ABLE account, Achieving a Better Life Experience. So that's for individuals who became disabled prior to age 26, where you can put your money into this tax deferred account and so you can have more than the $2,000 in resources, or if you're married, $3,000 in resources. Because for SSI, remember, SSI looks at your income and resources. If you have more than $2,000 in countable resources as an individual or $3,000 as a couple, you would not qualify. But the ABLE accounts are excluded up to $100,000. And you can put $19,000 in a year into that account, and it would be excluded. The $100,000, there's no change for that. I believe the $19,000 has gone up a little bit from last year, that you can put that amount in the account and it would be excluded. So that would be, I think, a good thing if a grandparent wants to give a gift to their grandchild but doesn't want it to affect their SSI. If the grandchild has an ABLE account, they could just put that money directly into that account and it would not affect the SSI payments. And what was the second question?
This is Dawn Lyons. Before I move on to the other question, I think I just looked at it again, and it looked like it was in relation to the latest legislation that's been passed. If you know that if there has been any changes to the ABLE accounts or how they will work.
Yeah, I read that there were changes, but I couldn't find what those changes were.
Okay. So Julie couldn't find any changes necessarily, but I'm guessing there weren't any then, right?
It says there were changes, but I couldn't find specifics.
We have not been notified of any changes.
Okay.
Thank you.
Okay, thanks.
The other question was, and I'm going to read it because I don't remember exactly what he was asking. Why are services capable of being performed online so difficult? For example, I'm still waiting for 2 employers to be entered for wage reports from this February. I'm not sure how you
Okay,
can answer
so
that.
that sounds like our business services online. So that's when an employer reports wages to Social Security. And for that, if you go onto our website, ssa.gov and business services online, we do have a 800 number there where you can call to talk to somebody who can help with those issues.
Great, thank you. And Julie, I hope you don't mind. I'm going to go ahead and tell Dee Dee she can go ahead and ask her question since she has her hand up.
Yeah, that's what I was gonna do.
Hi, this is Dee Dee Formaster for the record. I was wondering, a lot of offices are no longer allowing you to come in person to their office. Is that still the case for the Reno office?
So I know that some offices were doing that in air. So when we moved to the appointment focus model, encouraging individuals to make an appointment. Unfortunately, there seemed to be some kind of miscommunication where it was like you can only come in if you have an appointment, and the offices have been notified not to turn anyone away. So they will offer an appointment. So if you go to the office, they're going to say, "Can I make an appointment for you?" And if you say, "No, I need to be seen today. This is important to me that I be seen today," then they will see you that day, unless there's no one available. If it's the end of the day and there's no interviewers available, they could make an appointment. They could say, "Well, we'll see you first thing tomorrow." But the offices have been notified not to turn someone away because they don't have an appointment.
Okay, so I have one other question. Even though they're not turning anyone away, when you call in to try and get an appointment, like for instance, I have someone who, for some reason, I have no idea why, they have instituted her SSDI, but will not institute her SSI because they said she told them she didn't want it instituted, which must have been a mix-up somewhere. But when we tried to make an appointment for her, well, I'll be going with her. What happened is they said there was no appointments available and that we had to call back twice a week until they had an opening. Which seems like
I'm
waste of time.
Yes, I'm sorry about that. So we've been working very hard on improving our customer service. So we've been actually moving some individuals to the phones system who were from the field office to the phones. But this is a case where we need someone in the field office to help, and we've been moving employees from our central and regional offices to the front lines, for these issues, so that we can handle these appointments. So I do apologize for that. And again, if she were to go into the office without an appointment, there could be a long wait time. But I would continue to call. They can still make a lead even if they're not making an appointment. She should say, "I still want you to make a lead. I still want you to put my information into the computer so that she's protected." And then she can continue to call and say, "Can I make my appointment now?" Or she can say, "You know what, just call me back when you have an appointment time available." So instead of calling all the time. Now, the employees have what's called an alpha breakdown. So she would be assigned to somebody. So she can say, "I want to talk to the person who has who's in charge of my last name. And somebody has from everybody whose last name is from A through C. So she can talk to that person and say, can you let me know when an appointment is available so that I can get in my application for SSI?
Yeah, at this point, she's going to be dead before that happens. So I, I, I am a little bit frustrated, as you can tell, but obviously, I will just go ahead and drive up there, which is what I'm going to suggest today to her.
Yeah,
Thank you
and
for
I
your
do.
help. I
I
appreciate
do
it.
apologize for that.
I want to make sure everybody gets to ask the questions. So I'd like to ask the people limit the questions so
Okay.
that everybody gets a chance.
I'm done, Julie. I'm
Thank
just driving
you.
over there. Thanks.
Okay, Margaret, and then Mary.
Okay. This is Margaret Marcucci. So I wanted to let her know that not all areas of Nevada are allowed to have advantage plans. Where I live in Elko, if you do an advantage, you have to have your doctors in Salt Lake City or in Reno, if you're lucky to be able to do this. And this is what I find with a lot of my clients is they do not understand that.
Yeah, that's good information to know. So these very rural areas, the Advantage plan might not cover.
Yes, and then they're up creek without a paddle.
Mm-hmm.
Mary.
Yes, thank you, Julie. Good afternoon, Teresa. Thank you for the wonderful information. My question is about eligibility for SSDI. We understand that all of the research needs to be done in order for beneficiaries to receive these benefits. However, we're noticing a trend, I guess for the past couple of years, that it's taking no less than a year and oftentimes more for SSDI beneficiaries to receive their benefits. I work for a Center for Independent Living, and just through demand, we are right now focusing a lot on housing. And at times we'll have housing and we're trying to assist the individual to get benefits. But because of the timing, they won't get the benefits. So the housing disappears. Back in the old days, it used to be we could call some of the eligibility specialists in Social Security, and they would work with us as they could. Again, following all policy and procedure. That seems to have gone away. We do have some offices, and I'm in Clark County, Las Vegas, that are very responsive, that will actually pick up the phone, and other offices that are larger that you can't even get an appointment with or talk to. And then for the national numbers, it is somewhat disheartening, but we've learned that if you're calling Social Security, just plan to call, let it ring, be on the line, take care of a lot of other tasks, and wait till your turn. And I'm wondering if that's still a fallout of COVID. But I guess my big question is there anything we can do to help? And like with Dee Dee, with her beneficiaries, sometimes we feel that our consumers are in a state where it's critical. Is there any possibility for critical necessities for individuals?
Right. So Social Security does prioritize cases. So if somebody has a terminal illness, or if somebody has a condition that falls under the compassionate allowance. So there's let's say about 250 conditions that meet the criteria for compassionate allowance. So early onset Alzheimer's or pancreatic cancer, and those are pulled first and worked on first. And also, they don't need as the information that was generally needed in a disability claim. It collects we collect less information. So when somebody makes an allegation and it is a compassionate allowance criteria, we no longer ask the questions about prior work. We don't ask about education level. The analyst just needs to verify that the person has this condition and the claim will be approved. And I've seen these claims because medical records are now being sent electronically many times. I've seen some of these cases approved within a couple of days. So if you go to our website and look up the compassionate allowance criteria, you can see if they meet any of those conditions. And you would want to make sure that they put that in as their disabling condition. Somebody might put down that they have back pain, and because that's what's bothering them the most right now, but they have other conditions in addition to that. And they want to make sure that they list everything, because it could be that condition of impairments could be what approves them, or they could put down an impairment that meets the compassionate allowance criteria. You can also see online on our Blue Book, it has the listing of the different conditions and what the analyst is looking for in order to make an approval. Mm-hmm. So if you have access to somebody's medical records, you can see, you can say, look, the Dr. Smith here says that this is what the individual has, and in your listing of impairments, you say that this is what you need to see to make an approval decision. So something like that can help the analyst to make a decision more quickly. They might have hundreds of pages that they're trying to read, but once they find something that will allow them to make an approval, they'll make it. They won't continue going through the rest of the medical records.
Thank you, Teresa. We're familiar with the Red Book. We're not familiar with the Blue Book. Where on the SSA.gov could we get a copy of the Blue Book?
It's under professional services.
Okay.
And I can actually, if it's okay with Dawn, I can send the link to her, and Dawn can send it out to you.
That would be great. Thank you.
Okay, you're welcome.
Any more questions? I don't see any other hands. Do you, Dawn?
This is Dawn Lyons. I don't see any more hands, but there was a comment made in the chat, and I'm not sure if she wants me to read it. Stephanie Crown, would you like me to read your comment, or do you want to voice your concern?
Well, just really briefly, I think I have a partial answer. I'm trying to remember. I tried to open that my Social Security account for my daughter. We're just starting a little bit too late because her Katie Bickett Medicaid is going to end in 4 months, and it could take longer to get SSI. Anyway, I couldn't open that account, and I saw an error message, and it appeared that it's because she just doesn't have any records on her, doesn't have enough to really verify her. Is this something where, like, the technical support line, where that might help, Teresa?
There used to be a time when you could come into the office with your ID and we could start the registration process. But now we're told it has to go through login.gov. So if you were to contact login.gov,
okay,
they may be able to authenticate her.
In other words, call login.gov tech support,
right,
and see if that could. Okay, thank you so much.
You're welcome.
Appreciate it.
Any other questions?
Don't see any more hands up.
Teresa, I want to thank you so much for this informative presentation.
Thank you, and thank you for all you're doing in the community.
Okay. What I'd like to do next is go back to number 5 and then take a 10-minute break. Does that sound good?
This is Dawn Lyons, and I
I
cannot
mean,
remember. No, I
I'm
think
sorry. I meant to say number 4.
you meant to say number 4. That's what I thought you meant too.
Yeah, I apologize. I meant number 4. Are there any people in front of the public who would like to introduce themselves who may be interested in joining the council?
This is Dawn Lyons. I don't see any hands up, but I can't recall if Randall Owen is here, and I'm not sure if he was able to introduce himself last time because my memory is kind of poor. So if you weren't able to, I just wanted to make sure that the council knew that Mr. Owen is applying to be a council member. He'll be an ex officio, of course, but with his expertise, he will be a valuable asset to our council. So I just wanted to make sure that he had a chance to introduce himself if he wanted to. He may be busy, I'm not sure. He comes to us from the Nevada Center for Excellence in Disabilities. He's the director there, and really happy to have him once he's appointed. So, oh, there you are.
Sorry, I came back to my office and my computer was gone, so I'm on my phone. Not sure I'm gonna work the rest of the day, but yes, I'm glad to be here, glad to join you. Thanks for having me, and as I wait until I'm official, but I'm glad to be here and be part of the meetings for now. So.
Thank you for joining us. Okay. So I know what time do you have?
I have 2:13.
Okay, so in 10 minutes at 2:23, we will resume with updates. Welcome back. No worries. Okay. So we're gonna start with an update for Hyann about the Youth Action Committee.
Thank you, Julie. Hi, everyone. My name is Hyan Bang. I'm the Youth Outreach Specialist. And I will be giving you an update on how YAC is doing right now. For our council growth and meetings, YAC continues to grow as a youth-led initiative for individuals with disabilities in Nevada. Meetings now are held twice a month, first and third Thursday from 6 to 7 p.m. We transitioned from Zoom to GroupMe for better real-time communication. So during the times that we're not meeting, we're still texting and messaging each other, keeping everyone updated. Membership updates. So we currently have 4 active members from Las Vegas, Sparks, Reno, and Elko. And our membership age requirement changed to 14 plus instead of 14 to 30 years old. We are now open to youth with family members who also have disabilities. So not just the youth that has to have a disability, we're open to those that have family members that do have a disability. Changes were made by member-led and approved by the council. So that was exciting. Outreach and events. So YAC members are encouraged to join me at any of the outreach events that I do through the year. We recently in June, myself and Stacy went to the Levitt Amp Summer Concert in Carson City to support Dee Dee for her fundraiser, and we made fruit kebabs and Jamie Delights to sell. Upcoming travel and learning opportunities. So we're currently preparing to attend the 2025 April Youth Conference, which is in Oregon in October. 2 of our members are applying for the scholarships. 1 member may submit a workshop proposal, so we're waiting to see how that's going. And then our goal for all the members to attend the April conference is that so they can bring back knowledge and be inspired, because this will help us launch our own annual youth conference here in Nevada. And we also launched at the beginning of this month our website, and I'm going to share it. So please take a look at that. Any of your comments would be nice. I heavily look into accessibility, and we're still trying to make it more accessible. And so far on our website, it gives us the history, the mission, members information, and for people who might be interested, more information, just when it comes to recruitment. And so I would ask everyone to refer any youth with a disability or have a family member with a disability to take a look at our website, and hopefully they decide to join. Yeah, and so thank you so much.
Thank you, Diane. Very, very exciting. Okay. Next up, Mary.
Yes, good afternoon, Julie. For the record, this is Mary Eagle-Sizer. And Hyann, great report. It was a pleasure to see you at, I believe it was the Fair Housing Outreach. Okay, Julie, can you hear me?
Yep.
Okay, great. Okay, wonderful. For the record, I'm reporting for Clark County, Nevada. And this last quarter, we received 1,007 service requests. Of the 1,007 service requests, 821 were for information and referral, and then we also had a total of 87 new intakes. An intake is an individual which requests direct services from a Center for Independent Living. And so with this number, we have an increase of 10.4% of information and referral calls. We do have a decrease of 26% in intakes. Last quarter, we had 118 new intakes. This quarter, we had 87. Therefore, we have a 26% decrease. But I do feel that it is in the trends that we are seeing at this time. Our numbers are healthy, they're on target to what we thought they would be. The trends in information and referral calls versus intakes, we have been getting calls at the center from some of our consumers that are immigrants and who are also individuals with disabilities. So, because of the current state of affairs in our country, with knowledge with immigrant affairs, they're asking us what they should do. When this whole situation first started, we started researching with immigration. You know, in other words, how do you develop an independent living plan to return to your home country? So with the immigrants, we're giving them the option. We say, of course, you can stay. We have no control over what's going on. Or if you'd like, we can guide you towards, you know, developing a goal or an independent living plan to return to your home country. But again, independent living is all about consumer choice. So that's where we're at with that. Then I'd also like to report other services that we're providing. 18% of the services were for, of course, advocacy and legal services. Again, the highest number of service requests that we get through our direct service provision is 52% for housing services. And again, we're getting our usual benefits counseling service requests, transportation services, and peer counseling services, assistive technology, with those being in the smaller percentages. Again, our next highest percentage being requests being for assistance in applying for benefits, whether it be Social Security or whether it be veterans learning about Social Security that are also receiving Veterans Administration benefits. And of course, then there's Medicaid and Medicare. So that kind of gives us a feeling for the trend on what's going on in Clark County for now. With that, we participated in 71 outreach events this last quarter, letting individuals know that our services are here and what services we provide. And some of the highlights were the transition school nights at Chaparral High School for school to work transition youth. We attended the Silver State Fair Housing Outreach. We also attended 2 homeless encampments, and these are pop-up encampments where we go out to the homeless areas, provide information about our services, and have the capacity to do intakes on the spot. We also did an outreach for the Hawaii Pacific University Assistive Technology Fair, Harmony House outreach, and we also do a lot of outreach by email. So with that, we sent out 65 outreach emails. I do want to announce that in the month of July, the Southern Nevada Center for Independent Living is having its premiere newsletter. And Don, we will be sending you a copy. And if you would like to share that with your list, that would be great. And also, we weren't sure about the protocol, and we'll talk about this later, but just to pick up on the SILC member list and add them to our newsletter list. And if they want to unsubscribe, they are, you know, they can do so. Okay, with that, we also want to announce that the City Council here in Clark County, Las Vegas, Nevada, that is, have approved October 25th, 2025 for the annual Disability Awareness Day. And this year we're going to go back to something we haven't done in a while. We thought it was time to have something a little lighthearted and fun. And that's where we invite all of our consumers and all of our vendors to wear a Halloween costume for Disability Awareness Day. And that is always a lot of fun to see some of the really nifty and neat costumes that our consumers come up with. There will be two drawings. One will be for the best consumer Halloween costume, and then one, not two drawings, but two contests. One for our consumer best Halloween costume, and then there will also be a contest for our best vendor Halloween costume. Okay, with that, that concludes my presentation of our data for the Southern Nevada Center for Independent Living. I have also included in the chat the flyer for Disability Awareness Day, and we are posting the application online on our website. And so we encourage all of you to attend that can. And I thank you for your time for that. And I also have one more component to my report this time, and I will be open for any questions after this next section. I had emailed Dawn. Currently, the Southern Nevada Center for Independent Living has two grants with ADSD, SILC, and both of them are for housing. Our first one, grant 1925 9BX24, was approved to fund only housing transitions, and it started on 10/1/23, and the project period ends on July 31st, 2025. The grant award was for a total of $33,000. With our last request for funds drawdown, we have a balance of $8,900, and SNCIL would like to request for an extension of the $8,900 until, let me see, September 30th of 2025. The reason for that being is SNCIL hasn't been slack in working with consumers or transitioning consumers. Actually, we've done really well. At this point, we have 1 month and we're working with 4 different individuals. And one of those, no, actually 2 of those are for institutional transitions, which are our priority for our services. We do not believe that within 1 month we'll have time to complete those. I know for sure we'll have time to complete one of the institutional transitions, because that's an individual transitioning from one location to another, from an institutional setting to a permanent forever home in the community. The second one that we're working on, institutional transition, is a little bit trickier because we're working with an individual with a disability who transitioned from a prison to a rehab hospital, now back into the community. That's going to take a minute only because this individual's documents were all lost, and that takes a minute. We're also working with the individual to get back the individual's Social Security benefits, SSDI. So we know that's going to take a minute. We're working with another 2 transitions that are also going to take time. Again, the purpose of this program is just to provide support with rental application, move-in deposits, first month's rent, and forever home setup. Of course, with our program, we also seek other resources at first, and these funds are our last resort. So that's one program that we're requesting an extension through September 30th of 2025. Our second program is a program that we're very excited about. This was a program wherein the ADSD SILC grant was able to provide funding for a 50% or a part-time, full-time employee as a housing specialist. This project was approved. Of course, we had a budget modification. So the final approval was on March 11th of 2025. And then so it was approved after budget modifications because the rollout was January 1st, 2025. But we did request a budget modification to include $9,000 to again help individuals with first month's rent, with move-in costs, and any deposits to help them to transition again from a high-risk living situation to a permanent forever home. And again, because of the late start in this project, we did begin recruiting and we were able to hire a housing specialist who does come to us with a lot of really good HUD experience and housing experience on June 9th, 2025. So we are requesting for an extension of that grant, which is due. The project end date is 12/31/25 to a September 30th, 2025 date. I know this is a lot for you council members to take, but we wanted to share with you what is happening with the SNCIL ADSD grants that were awarded. So thank you for your consideration. And at this point, I am open to any comments and any questions. And I do thank you for your time. And SNCIL does thank you for your support.
Before we take questions, what's the process for those extensions that were requested?
So this is Dawn Lyons. We in our policy procedure manual, typically, because this is something that's time sensitive, typically the executive team would just make that administrative decision to help move things forward. But I did suggest to Mary that she might want to include the SILC on this just for discussion purposes, mostly to see if the SILC had any input or thoughts on it.
I think it's a reasonable request. Are there any questions for Mary?
This is Dawn Lyons. I only would just like to request that you send me those dates on those specific NOSAs, the notice of subaward for short, NOSAs. If you could just send me the exact ones with the dates that you're asking for to be extended in an email so that I have it in writing and I won't forget and get them mixed up.
Of course. Of course, it gets confusing. Thank you. I appreciate it. And thank you for the opportunity to share with the council where we're at and how we're doing.
Great. Next up is filing to talk about the Nevada Center for Independent Living. I need Lisa. Lisa, I'm sorry. I'm having a brain fart.
No problem, Julie. Thanks so much for the opportunity. I'm going to warn you right now, we are having some serious computer issues. So I'm holding my breath.
Okay.
I appreciate everyone's time. It was a great Social Security presentation. I'm sorry I didn't get a chance to thank her in person, but boy, that was a lot of really great information. We here over in the Northern Nevada Center for Independent Living are doing a big push in our outreach at the moment. I will say we're continuing to work on housing. Housing, as we all know, is, kind of like the little problem that won't go, and that's the big problem that won't go away. I will say that one of our funding streams for housing, the City of Sparks, that funding will sunset in September. So we don't have very much left there, but we're busy spending down what we've got there. We also hosted a couple of it's a second year that we've hosted the Washoe County School District's blind and low vision students in our facility. And we had about 40 of them here, and we were able to host. I'm sorry, Don, I looked up and saw your face and I thought, did I say something wrong? We were able to.
Sorry, Lisa. I was surprised at the number. That's quite a bit of students. That's all.
Oh, it was a lot of students, and it was a very hectic event. because it included ice cream, so it included a lot of wiping up as well. But it was really cool. We had 9 service dogs here from Guide Dogs for the Blind, and they were all puppies in training. So the kids were able to be hands-on and understand a little bit more about what a dog might be able to do for them as they have their journey. We had hands-on art, and said was here. We had a meta glasses demonstration that was very cool. Talking Books was here. The Notables Music Therapy team was here. It was just a really great, great event. And we look forward to working with them again next year. We also had the adaptive bike, City of Sparks. I'm sorry, City of Reno has all the adaptive bike and adaptive recreation materials. And so we were able to rope off our parking lot and have adaptive bikes out there so that the kids could try different ways of riding bicycles. And that was really fun. And then, of course, the ice cream truck. Our MS peer support group has started again here the first Tuesday of every month. And we this one really does deserve a face. We had our first blind cooking group test our new kitchen. That was we've just recently remodeled our kitchen, and
Good.
it's completely different now. And so we wanted to have a group come in and try it out. Is somebody asking a question or?
I'm not sorry.
Oh, no, no, no problem, Julie. So we had our first cooking group in there, and actually, Dawn, I think you might have been in our offices that day. I understand I happened to be out of the office that day, but I understand it was a lot of fun, and everybody had a good time, and we learned a lot about our kitchen. And some things have to be reorganized to make it a little bit more accessible. Um, we've attended several health fairs out in the rural counties, and we continue to work with the emergency management personnel, um, with collaborating with them on their drills. We were just in Carson City the other day working with them on one of their drills, and we'll continue to do that as part of our emergency preparedness plans. We're very, very busy, as I'm sure Mary is too, with content creation for the Nevada Trip website. That is a huge undertaking, and so we're really excited about it, but it's a lot of work at the moment. And then we've been working with the Nevada Department of Transportation on what am I trying to say? A modification here on the street where our office is. It is not ADA compliant. And so they are actually coming in and going to be expanding the sidewalks to 5 feet, which is that was a very big deal. So we're very excited that work is getting done. We also hosted, this is kind of funny. This one really deserves a look. We hosted Blind Burners International here in our office, and it was a very cool event. They did Blind Burners taught acro yoga here in our office, which was interesting. And they brought some very cool art as well as a tactile map of the Burning Man. So that was a very, very fun thing for people to be able to participate in and touch. And they also had a tactile um, model of the temple, so you could feel what people were talking about as far as the temple that they have out at Burning Man. So that was a very interesting afternoon here in the office. And then we hosted Mark Wellman Day, as we always do, the first Sunday in June. We had about 400 participants, and that was the adaptive climbing wall, bikes, kayaks. We had 42 vendors there that were all people who provide. Gosh, my brain is just like locking up for some reason. They're all people who provide services for people with disabilities. So it was a really great information fair as well. And I would like to encourage everyone just to kind of tag on to what Mary said. If you do not already receive our newsletter, if you go to nncil.org, there is a place there to subscribe. And that kind of keeps you up with everything that's happening up here in our area in the north. And I think that's about it for me.
Thank you, Lisa.
My computer held out. Yay.
Yeah. Any questions for Lisa?
This is Dawn Lyons. The first thing I want to say, Lisa, is, when Hyan and I came out, and we did happen to be there on that day when you were unfortunately not there, but Mark Tatter gave us a tour, and we tagged along with the group, and it was an amazing kitchen, I have to say. And we were also really impressed with all the things we heard and saw going on in your center. And I just wanted to express our gratitude for allowing us to come in, and your staff being so friendly to us, and you guys being great as usual.
Of course, I'm happy to hear that.
And then the other thing I wanted to ask was, you didn't mention Pumpkin Palooza. Is that gonna be going on this year again, or
No, there
no?
is no Pumpkin Palooza. It just, the city services got too expensive and we just couldn't afford, we weren't making enough money off of it to afford to continue to do it. So sadly, it is in the rearview mirror.
Okay, well, thanks for letting me know, and I
Of course.
appreciate it. Thanks.
Any other questions for Lisa?
Yeah.
No, I said,
oh.
Are there any other questions?
Okay,
well, thank you for your report.
Thanks for the opportunity. I appreciate it.
Next is Dee Dee with RCIF.
I'm going to try to go first before Dee Dee does, because we are having very bad wind and my internet keeps going. Okay, they were talking about ADA, and the Dawn knows where the office is. They are doing new everything for right in front of the office all the way down Railroad Street to bring it ADA compliant. The other day, they dug up a tunnel that the Chinese had. And so we're all waiting to do the tunnel tour this year. See if we can see that one. It's fun. Let's put it that way. And Dawn knows, I have to confess, I haven't been doing anything. Dawn knows that unfortunately in the end of April, I had to have a pacemaker, but I am back 100% now, Dawn. So you guys know, I've been doing the ADA health training, which is an ongoing event. I have 4 more to do if they send me the information. Dee Dee and Chris, who's my wonderful helper here, did the volunteer fair. And I am going to a nonprofit training the 17th and 18th that one of my friends decided I needed to go, and they paid for it for RCIL. I'm getting more new people every day. In fact, I was on the phone with 2 people while we were here. I work with the PACE Coalition, and do all that. I work with the VFW again with we do housing, food. They have their pantry. I'm just a person that brings information, and I'll sit down there on. They're having an event Saturday or Friday or Saturday and Sunday, and I will go down and bring information for them. It's just I'm trying to get going again. I go to the welfare, Medicare, Medicaid help. That was great because that answered every question I had that maybe my one lady who is having problems getting anything done will get it done. But that's all I've got.
Thank you. Dee Dee, what's clear on you?
Hi, this is Dee Dee Formaster for the record. I'm with RCIL. I'm the director here in Carson City. Well, we have been incredibly busy. We have a lot of clients coming in for housing, but I must say that housing is absolutely miserable right now because everybody has stock income information that you have to have before they'll even rent to you. So now in Carson City, in order to get a 1-bedroom, you have to make $32,000 a year. And most of the other rental complexes are falling into the same thing. So I have referred a lot of people over to vocational rehab so that they can work part-time and collect their disability at the same time so that they will be income eligible for some kind of housing. It's even higher for a 2-bedroom. You have to make $30,000 a year for a 2-bedroom, and you have to make between 37 to 44 for a 3-bedroom. So it's getting exceedingly difficult. But we're still working hard on trying to dig up individual landlords who are willing to work with us. So that's the route we're going at the present time. We have also been doing a lot of work with, gotten a lot of referrals from Nation's Finest for veterans that were in the National Guard, and even though they were overseas fighting for us, they still are not considered veterans. So, which I find very interesting. So Nation's Finest is referring a lot of them over to me so that we can work on trying to help them get into some kind of housing. And we also are working doing fundraising and outreach with the Brewery Arts Center on their music festivals every Saturday night. So we're doing outreach by putting our brochures out and talking a lot about CILs and also providing information for ADA while we're also there. So it just gives us a great outlet. And the money we're earning, we're hoping we can use towards getting a transportation van eventually. So we're up to about, we're hoping to be able to do some fishing this month and next month, and also some kayaking. So we have been working on trying to increase our outreach also for our support groups. So, and that's about all we're up to over here.
This is Margaret again. So you guys know Elko's getting ready. The mines are getting ready for another massive layoff. So I expect to get more phone calls than you know what to do with. Also, I don't know if you guys have ever heard of the Moses Project. I have been working with a lot of their people to get them housing and things like that, which is for people with foster kids. And being that I was a foster mama, and it makes me happy. We're doing clothing drive, food drives. As I said, I work with the VFW and I work with Moses Project, and I work with anybody that comes in, whether they are a client or not. If they need something, I'll see if I can find it.
Thank you.
This
I
is
would-
Dawn Lyons. Margaret, you wear a lot of hats.
Yeah,
What, Don? I'm sorry.
I said you wear a lot of hats.
I do, but you can tell I feel better.
Yes, that's
100% better. Let's put it that way. When he told me, go for it. And I'm like, I'm not doing any more than what I'm doing right now. And I had to drop off brochures and cards to 4 doctors' offices as I was leaving yesterday. So if that tells you anything, I'm really gonna get going. And I have awesome helpers. I would not be able to do anything without Chris and Maria and Doris. Let me tell you, those guys, when I was down and out, they were there along with Dee Dee.
I'm so glad to hear you're doing much better.
I am. I walked into the doctor's office. The doctor looked at me and goes, "Oh, great. Here we go again." I said, "What do you mean?" He goes, "Remember I challenged you before we had surgery?" And I said, "Yeah, I'm challenging you again. Here you go. Exercise bike, walking up to 10,000 steps a day. And I can do chair yoga, but still can't do anything with my upper arms. That will be next month. So I am getting back into shape. And when I get going, I'm going to have a grand old time."
okay. Thank you. Does anyone have any real quick questions? See none. Is our legislative educator here?
Hello, Sutter Rawlings. I'm the legislative educator for Rural Centers for Independent Living. I am present.
Would you give our update?
Yes, let me open my written up report right now. All right. In my time as a legislative educator for Rural Centers for Independent Living, I began collaborating with Vanessa Dunn to create a one-page document explaining the benefits and impact CILs have on their communities. I also worked with her to create a brochure for Rural Centers for Independent Living to have an updated version of the previous brochure. I attended a legislative training Zoom call provided through the Progressive Leadership Alliance of Nevada. My first appearance at the legislature was with the Developmental Disabilities Day on March 3rd and 4th. On the first day, I attended a legislative training presentation, and I also sat in on a meeting for the Assembly Committee on Health and Human Services. The next day, I worked with Haiyan Vang and Dee Dee Formaster to run the RCIL event table. Later on, I worked with Sarah Adler, a paid lobbyist, to learn how to meet with legislators and present to them about the Centers for Independent Living. Sarah helped me practice my pitch and presentation, as well as taught me how to make meetings with the legislators so that I could get in contact with them frequently. In my time at legislature, I met with Senate Minority Leader Robin Titus, Senator Dr. Jeff Stone, Assembly Member Rebecca Edgeworth, Senator John Ellison, Assembly Member Burt Gurr, and Senator Lori Rogich. All of my meetings with them were very productive and meaningful, but the most memorable and very meaningful meeting was with Lori Rogich. My meeting with Senator Rogich lasted over 30 minutes as we spoke about the difficulties for the disabled community in Nevada and what Centers for Independent Living are doing to help. Senator Rogich spoke of the difficulties her own daughter experienced as a member of the disabled community living in Las Vegas and the ways that she's seen improvements upon these conditions in other locations. I gave her the contact information for the Southern Nevada Center for Independent Living, as that's where she lives. We exchanged business cards and other contact information, and she held on to multiple copies of the one-page educational document so that she could pass on the information to colleagues. That was probably the most successful and very exhilarating meeting. We connected very well. Her daughter is now currently a student of Utah State. So she spoke about how good they have transportation for the disabled community and how she would like to see that move into the city environment of Las Vegas. Because while Las Vegas is a city, its disabled community is still having a very difficult time to get around and to have transportation. She said some problems will always be problems, but there's always a way to find some sort of solution for some of these things. And she was able to find that in Utah for her daughter. So, yeah.
Thank you. Is that the end of your report?
Yes, at least of the bit that I had written up.
Okay.
I
If
have a
you have
comment.
any
I have a comment, Julie.
Yes.
He talked to Ellison and Gurr. I've known them for years and years and years, and they contacted me, and they are really happy, and they are willing to give the support for RCIL here in Elko.
Hey. Any questions for Sutter?
This is Dawn Lyons. I have a question, Sutter. I really am glad you shared that information. I am impressed at what you were able to accomplish, and I appreciate your reporting that all back to us in detail that you did. The meeting with Senator Rogich, and you were talking about her daughter and the follow-up to that. Do you have, I'm wondering if maybe Mary might be able to, I doubt it right now on this on the spot, but if Mary would, let me know how who's working with her daughter, if she's gotten in touch with them, and how that's working out. I'm curious to hear the follow-up story on that. So, and if Sutter, you ever hear anything more, I'd love to get that update from you as well.
Yeah, absolutely. I can email Mary with the contact information. I do have her business card, so it will be routed more towards her business side. It's not personal in any way, but I believe that she'll be able to get it routed correctly. And yeah, she did speak that it's her daughter's last semester at Utah. And so she was worried about how life for her will be returning to Las Vegas. And that's where I was like, definitely get in contact with SNCIL. We will be able to do everything we can to help out. So, yeah.
Right. Thank you.
Very.
Thank you, Julie. And Sutter, thank you. I just sent you a chat. Please send me your information. This will make a great follow along and a follow-up story for how we work together in our state and our community. Also, if we see other barriers that are there, then we can all work together to try to remove barriers. So Sutter, we're very excited to work with her. So if you'll send me the contact information, I'll take the initiative to reach out. Thank you.
Of course, I'll send you that right now through email if that would be best.
Thank you.
Terrific. It's glad to hear.
Let me give him a minute in case he is and I just don't see him.
I haven't seen him.
I haven't heard from him either, and I did send him the meeting information, so I'm not sure if maybe he may be on some kind of leave or something. I haven't heard from him, so I'll check with him after the meeting and see if maybe we can circle back to hit this item tomorrow if he can be here tomorrow. If not, I'll let you guys know an update then.
Okay, great. Next, update on the rehab council.
Yeah, so this is Dawn Lyons, and I am on the rehab council, as you know. And the meeting was back in May, and they set up the biggest thing that happened, I guess, that I could express is, other than updates on the Nevada trip program, were that they're starting to plan their report, and so they actually met today. So I couldn't be part of that subcommittee this time, at least not for this meeting, but I can get information about it and bring that back to you next time, because that's going to be exciting to see how that evolves.
Terrific. ADSD update.
Good afternoon. Oh, hi. Sorry. Didn't mean to cut you off, Julie.
It's okay. Go for it.
Okay. Thank you. This is Lori Lutu for the record. Just a few updates from the ADSD side. So now that session is over, we are looking at what the impacts to our programs and services are, and also evaluating our implementation measures. And just a few high-level changes or things that did happen during session for ADSD is our Office for Consumer Health Assistance program. They were able to establish caseload ratios. As far as funding goes, wait lists for our programs were not funded. So we're not able to actively get people off wait lists with the funding that we received. For our early intervention program, IDEA Part C office is going to be moving under ADSD. And we were able to keep the provider rate increases that we had implemented for our COPE and our PAS programs. So just kind of some high level things. Yes, we are happy to be able to get that for COPE and PAS. Just a few program or project updates. So we are continuing to work on our PCA, our Personal Care Assistance Workforce Project, and which addresses the workforce shortage in relation to PCAs in the state, and also looks at some of the training requirements and pipeline work, and also looking at how that could filter into other professions or use it as a stepping stone for those who might be interested in that. So a lot of great things are happening within our PCA workforce project, and one of the other regional coordinators is the lead for that project. Just some other updates. So we have had some changes in staffing within ADSD at some of the higher levels. So Dina Schmidt has transitioned to a new role, and so Ricky Robb has been promoted as our administrator. And the position she was in as deputy administrator has now been filled with Samantha Jaime, who was previously with our Autism Treatment Assistance Program. And Jeff Duncan, who some of you may know, he has left ADSD, and he has been replaced in that position by Cheyenne Pasquale. So looking for, at some point, a new planning chief, which is what Cheyenne's role was before. It hasn't posted yet, but probably, hopefully, by next meeting, I'll have an update on who has been placed into that position. And then just the last update I wanted to give is that ADSD has recently gone through a rebrand process, and it rolled out internally and also to the public. The goal with the rebrand was to unify our division, clarify what we offer, and increase awareness and trust across all programs and with the community. So you may have already seen or will begin to see new email signatures, new letterhead for certain things. So just some overall updated, refreshed messaging that we want to use to connect internally and with the community. So that's all the updates for ADSD. Does anybody have any questions?
Mary.
Hi, Lori. It's always a pleasure to see you. Thank you. Lori, I think I heard the answer, but I just wanted to verify. Were the wait lists for the waivers impacted at all?
So as far as wait lists across the division, we did not get any funding to address the wait lists.
All right, thank you. Just wanted to make sure.
Yeah,
maybe
thank you
next
for
time.
the question.
Any other questions? Larry, thank you for the update. Okay. Did anyone go to any conferences since we last?
This is Dawn Lyons. There haven't been any conferences that anyone has attended since our last SILC meeting. However, Nickel is coming up. Registration is already open and everything, and I am planning to go. I didn't receive word from anyone else that they were interested, so I think it's just me this time. And then the April Rural Conference is coming up in October, and they're soon going to be opening up registrations. It's going to be in Portland, Oregon this year, and we're really excited to be working on trying to get some of the Youth Action Council members to be able to go on utilizing some reimbursement from either their scholarship programs or our third-party fiscal agent, or both, depending on how that works out. I know several of them have applied for that scholarship, so hopefully at least a couple of them would be able to get one of those. But it's just really exciting to see the Youth Action Council growing and moving so fast and really making progress. So I just want to give props to Hyen for all the hard work she's been doing, and let you guys know that we're really trying to support them in their efforts, because they're making leaps and bounds right now. So if anyone is interested in going to April, I need your name so that I can make sure you get put on the list to be registered for attendance. And I'll send out another email about information on the dates and what they sent us so far, as much as we know. I'll let everybody know, but you can contact me, and we can talk about the details if you want of what I know, and let me know if you're interested.
Okay. Moving right along. Updates on the Department of Ed.
Yeah, so this is Dawn Lyons again, and I just want to say the last time that all partners met, we focused on building training for youth service professionals through the NDE's Canvas learning management system, and included updates on partner contacts and advisory work group recruitment and retention. The team discussed progress on independent living courses, recreational activities for students with disabilities, and roll out the website in Spanish by the end of the summer 2025. So they've been doing a lot of work on that. We reviewed the upcoming events, the meeting schedules, and content development plans for the year 3 of the grant, which will include additional counties. And so, we're going back past our pilot stage now. So that's getting exciting to roll over into adding more counties to the program. And we're also so NDE or Nevada Department of Education is bringing on a Responsible Advocacy and Consulting LLC. The manager is Wendy Yankowski. She's going to be the new Nevada Trip Project Coordinator, and she's going to be capturing lessons learned by the 3 pilot districts and create replicable systems and a menu of transition services for use by school districts throughout the statewide rollout of the grant in years 3 through 5. So that's where we're at with the Nevada Trip.
Terrific. Any questions for Dawn? No. And now the moment we've all been waiting for. Final numbers. 7 officer nominations and elections of chair and vice chair. Since I assume I'm going to be running, I'm going to turn this over to Dawn.
Thank you, Julie. So this is Dawn Lyons, and this is our annual election. So
Yay!
So the first position we're going to go ahead and take nominations for and then votes is for the chair of the SILC. Would anybody like to nominate someone? I mean, even if you just want to nominate Julie to continue, just, speak up if any member has a nomination for the chair of the SILC.
And hello, this is Obiama officer speaking. I have a question. Am I able to nominate someone at this point or no? Am I allowed to vote?
So this is Dawn Lyons. You're not a voting member, but you are always allowed to nominate.
Okay. Then if no one objects, I would like to go ahead and nominate Julie again.
And I accept the nomination.
Wonderful.
This is
Thank
Lisa
you.
Bonney for the record. I'd like to second that nomination.
Thank you, Lisa.
Great. Is there another nomination for anyone else before we take a vote? I don't see anything else. Okay. So I know you're accepting the nomination, but just so that we can go through the motions and do this accurately, I'm going to take a roll call vote. And if you choose yes or no, okay, so just say yes, you agree with her nomination, or no, you do not. Sabra McWhorter Clark.
Yes.
Margaret Marcucci.
Yes.
Linda Voivoda.
Yes.
Dee Dee Formaster.
Yes.
And Lisa Bonney.
Yes.
Thank you unanimously, Julie. Congratulations. You're our chair for another year.
I think we've really done a lot of great work this year. And I look forward to what's to come.
Okay, moving on to our second nomination that we need is for vice chair. Do we have any nominations for vice chair?
Hello, this is Sabra McWhorter Clark for the record. I'd like to nominate Linda Voivoda for vice chair.
Wonderful. Thank you. Linda, do you accept that nomination?
Yes, I would love to.
Excellent. Any other nominations for vice chair? Okay, hearing none, I will go through a roll call vote. And once again, if you agree that Linda Voivoda should be vice chair for the SILC over the next year, say yes. If you do not agree, say no. Julie Weissman Steinbach?
Yes.
Sabra McWhorter Clark?
Yes.
Margaret Marcucci?
Yes.
Dee Dee Formaster?
Yes, 1,000 times over.
Lisa Bonney?
Yes.
Thank you, and congratulations, Linda. You are also unanimously voted in as vice chair for the SILC for the next year. So congratulations to you both.
Thank you.
Thank you very much.
And then if Julie, if you wouldn't mind going ahead and just announcing who the appointed officers are for treasurer and secretary over the next year as well. I think that's just a formality.
Can you remind me?
Oh yeah,
Sorry.
sure. So currently
You
our treasurer is Margaret Marcucci and our secretary is Sabra McWhorter Clark.
I'd like to reappoint those people in their current positions.
And as long as Sabra and Margaret have no objection.
I have no objections. I told you I would. And I told Julie I would.
This is Sabra. I have no objection, and thank you.
Thank you both. Thank you very much.
Thank you a lot. We have a great team. So I'm really excited. Okay. We're getting good public comment. Lauren, could you read the spiel?
Sure. Took me a little by surprise there. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
Are there any public comments?
I'm just now letting Obioma back into the room, so we may want to ask her once she's back in.
Okay.
Yes, I'm back. I'm back. Okay, sorry about that. I wanted to use the raise hand feature and then I ended up closing the system. Okay, so now I can make my public comment, right? Or we're good?
Yeah. Yes.
Excellent. This is Obioma officer for the record. Sorry about that. I wanted to just remind the community to just share the information that on July 22nd to July 24th, we will have the Deaf Nation World Expo here in town. It will be in Las Vegas. It'll be happening here, and it is a free event to attend. It will be at the Westgate Hotel. And that's where it will be on the grounds there. And there will be a table shared by the CAS program, the Deaf and Hard of Hearing Commission, as well as COCHA, and one more organization. I'm sorry, Lori, can you remind me? I'm sure you could. What's the one more? Whatever the case is, we will be there representing. We'll have a vendor table, ADSD, and there will be over, I want to say the last count we heard was 12,000 deaf and hard of hearing individuals coming internationally, so from all over, coming to Las Vegas for this event. They are prepared for 16,000 people at this point, and the numbers keep increasing, and they're doing so quickly, which is great. So that number was what was quoted to us 2 weeks ago. So probably at this point, it's much closer to 14,000 or even more. We don't know. But that being said, it's open to everyone. It's free, and you are welcome to come and to join us. There will be sign language communication in different places. Sponsors, our booth will have an interpreter who is present, who is ready. I think we have 4 booked for that particular event for both activities for 2 days. So the 22nd is, I think, clarify, it's Starbucks night. Oh, it's kickoff night. Excuse me, kickoff night. And then the second day is all day long, where we have our vendors booth set up, resources. There'll be over 200 different vendors available to reach out to and to talk to, and you can get different resources for the deaf and hard of hearing community. And the third day is the same thing, but they also have different events and different activities. There's basketball, my screen is freezing just a little bit. Sorry about that. We'll have poker, deaf poker as well. So that week will just be full of activities, full of community-related events, and it really is a great time. It's a celebration for the deaf and hard of hearing community. So please, you're welcome to come. You're welcome to be a part of that. There'll be lots of other agencies present, state programs from all over the state of Nevada. So we're very excited about that as well. In addition, just come join in the fun and enjoy.
Thank you. Any other public comment? I don't
See any either, Julie?
We got a lot done today, and we have a lot to accomplish tomorrow. So
Yeah, one of the, Julie, if you wouldn't mind me mentioning
yeah,
that, just a reminder about the agenda item number 8 for the discussion on the federal budget. If people want to make sure they are prepared with the discussions and the portions of what they want to discuss about that tomorrow. I think you planned on opening it to the public, correct?
correct.
Yeah, so we could all discuss that. So that's going to be a good discussion tomorrow. So I just wanted to remind everybody about it. Thank you.
Okay. No. Okay. I'd like to adjourn this meeting until tomorrow at 1 p.m. Thank you all.
Thank you.
Thank you.